Now, lastly, for this dialysis, for the dialysis, we look at indications for dialysis in patients. So, a patient is sick. Yes, they obviously have issues with the kidneys, but is it good to just opt in for dialysis like that? It's not really cool. Okay, you must have to see some things, okay, that are making you to like want to actually go in for the dialysis. So for what we have, okay, indications, that's what are the things I will see in a patient that will want me to actually opt in for dialysis. So first of all, this is guiding you to actually make a decision. So decisions to initiate dialysis, of course, dialysis is very important. It stands in for the kidneys, all right, so that the patient is able to filtrate waste out. But you must be seeing some things that will make you want to go in for a dialysis, So of course, why you are making this decision is based on specific clinical indications. So this reflects the body's, of course, you are doing this because the body is not being able to use the kidney to filter out waste. Do you understand? So indications we use a mnemonic known as AEIOU. Okay, so A is the first one, or you say R, acidosis. So if the pH is going below 7.2, of course you should do that in the laboratory testings and make sure you know the pH is going below 7.2. all right, you actually initiate dialysis. Electrolyte imbalance. So if potassium levels are going high so much, you can initiate dialysis. Okay. Intoxication. So if they have been poisoned with some substances and the poison is so much that you know that maybe the kidneys have been affected too, or the kidneys can't actually filter out that poison so fast, you can go in for dialysis. Overload. So if there's too much fluid in the body, you can go in for dialysis. Uremia too. If there's high uremia in circulations, you can actually opt in for dialysis. I think it's creatinine too. Okay, so additional indicators. If the glomerular filtration rate is at the end stage below 15, something that used to be around 90, then you know that the kidneys can't keep up again. Uremic complications, if they are coming up, progressive weight loss is coming up, hypertension or heart failure is coming up. Do you understand? So it's very important to see at least one of these things before you actually go in for dialysis for your patients.